the National Institute of Diabetes and Digestive and Kidney Diseases, or the NIDDK, it's estimated that more than 500,000 people in the United States alone has Crohn's disease. My boyfriend, Lawrence, is one of these 500,000 individuals. He was diagnosed with Crohn's disease in 2012 and has been managing his symptoms for 11 years. Crohn's disease can be managed by using a combination of medical treatment and diet. Hello, my name is Jay Vidic, and I'll be informing you all about what Crohn's disease is, the medical treatments that are used for Crohn's, and how diet can manage Crohn's symptoms. We will now look at what Crohn's disease is. Crohn's disease, or Crohn's for short, is an inflammatory bowel disease, or an IBD, that usually affects the small and the beginning of the large intestine, but can affect anywhere in the digestive tract, as explained by the NIDDK. It is unclear how someone develops Crohn's, but according to Lisa Levin Sobczak's Crohn's disease, some believe that it's due to an autoimmune response. The NIDDK states that you may be more at risk for Crohn's if you are between the ages of 20 and 29, have a family member, usually a sibling or a parent, with IBD, or smoke cigarettes. They also give valuable information regarding the symptoms and complications that come with Crohn's disease. The most common symptoms associated with Crohn's are diarrhea, cramping and pain of the abdomen, and weight loss. Some other symptoms include anemia, eye redness and pain, fatigue, fever, joint pain and soreness, nausea or loss of appetite, and red tender bumps underneath the skin, but depends on the location and severity of somebody's Crohn's. Complications in those with Crohn's include intestinal obstruction or bowel blockage, fistulas, abscesses, ulcers, malnutrition, and more. Now that we've discussed what Crohn's disease is, we can move on to what treatments are used in the management of Crohn's. There are a very wide variety of medical treatments that are used to help manage the symptoms of Crohn's, as there is no specific structure when it comes to treatment. But these following medications have been mentioned multiple times in sources. One of these medications are aminosalicylates, which, according to the IDDK, contain a substance called 5-aminosalicylic acids, which help control inflammation. These medications are recommended for those who are newly diagnosed with Crohn's and have mild symptoms. Immunomodulators are also a type of medication that treats Crohn's disease. There are two medications underneath this category that are commonly used: 6-mercaptone purine, or 6-PM, and methotrexate. According to the subject, 6-M is an immunosuppressant which alters the body's immune response to a disease or antigen. Methotrexate also works as an immunosuppressant and has been shown to effectively treat other autoimmune diseases like rheumatoid arthritis and psoriasis, as stated by Alessandro Fischera and Boudica Crane, Crohn's disease basic principles. Last but not least, we have biological therapies. The NIDDK explains that these therapies work by targeting proteins made from the immune system and neutralizes them to reduce inflammation, and there is 3 different kinds of biologic therapies: anti-tumor necrosis factor alpha therapy, or TNF, anti-interferon therapy, and anti-interleukin 12 and interleukin 23 therapy. Infliximab, a TNF, is the therapy that Lawrence receives every 2 months. According to the National Institute of Health and Care Excellence, infliximab is recommended for those experiencing severe Crohn's that didn't respond to other forms of treatment. While medication is vital for Crohn's remission, diet plays an important part as well. One way diet helps with Crohn's management is to reduce inflammation. According to the article called Chronic Recurrent Multifocal Osteomyelitis Associated with Crohn's Disease, a Potential Role of Exclusion Diet, comment on STARS and others, the modification of gut microbiota via selected specific diets in patients with Crohn's disease. Published by Nutrients, exclusion diets were effective in inducing remission in Crohn's disease patients, even those who were resistant to biologic therapy. Even though many patients avoid fiber in their diets, Fischer and Crane state that some researchers found that the digestion of dietary fibers may help with restoring the immune tolerance as well as reduce inflammation. Soluble fibers like the fronts of fruits and vegetables and some grains like oats can be added to a patient's diet. Diet can also help with the healing of Crohn's complications. Fischer and Crane say that diets high in protein support the healing process of complications like fistulas. Chicken, turkey, fish, and eggs are usually tolerable sources of protein, but if a patient is not lactose intolerant, they can add dairy products to their diet as well. They also say that adequate calorie intake is important to a Crohn-specific diet as it gives the body fuel to perform body functions, day-to-day activities, and healing. While there are foods that can help with symptoms of Crohn's, there are also others that can trigger unwanted symptoms. According to Fischer and Crane, insoluble fibers like seeds and strings from beans, celery, and thick fruit skin are hard to digest with Crohn's. Patients also report pain and diarrhea when ingesting raw fruits and vegetables, seeds, nuts, and whole grains. High fat and greasy foods can also increase symptoms like bloating, gas, and diarrhea. Overall, it is important that patients make sure that they are getting enough nutrients to aid in remission. Hopefully, this information has helped you understand more about what Crohn's disease is, as well as how it's managed by medication and diet. Remember, not everyone who has an illness or a disease always shows physical signs of so. Just because we can't see what's underneath someone's skin does not mean it simply doesn't exist or it doesn't affect someone's everyday life. I hope that you will choose to show empathy towards these individuals rather than dismiss them. Thank you.